Hi there, this is Mark speech-language pathologist, and welcome to the Teaching of Talking website. Take a look around, there's lots of information here. However, what I want to just briefly speak with you about today is the Teaching of Talking 2.0. You know, speaking is best learned when you're talking, and talking requires at least two people. So what we designed the Teaching of Talking for was for caregivers and therapists. We teach you how to help the person with aphasia. We teach you all about it. We make videos, little short videos of 5, 6, 7 minutes, where I show you exactly what you need to do, and then you can turn off the video and then go right to it and help the person with aphasia. We have a bunch of videos in a program that's called the Teaching of Talking Online Video Program. And we start you learning how to identify speaking difficulties. We teach you to do a little screening test or a little evaluation of your own, where you can start learning about speech and the important aspects of speech that you must understand and truly realize to be able to help a person with aphasia. Now, I'm talking to you caregivers and therapists because there are people who are not all that experienced, and you want to learn how to use and put time on your side. And if you want time on your side, and if you want maximum results, you can learn the Teaching of Talking method. Hi, I'm Markittleman. I've been a speech pathologist for, 46 years. And in that time, I've helped thousands of people with aphasia speak better. Now, I've learned my lessons. I've learned what works, and I've learned what doesn't work. And before I left hospital work, I decided that all of that knowledge that I had, that I was going to document it and put it in a book and teach others how to help people with aphasia. And that way, all those years of learning, all those years of making mistakes, all those years of refining the Teaching of Talking method would be continued for years and years and years. And that's why I've developed the Teaching of Talking 2.0. If you've noticed that there is a Teaching of Talking 1.0, and that's a course, an independent study course that you study all on your own. I'm not involved with you. You can study it, and you can learn it, and you can apply it with the person who has aphasia. Now, what I've found in the last number of years is that a lot of people purchased the product but had problems and weren't really sure what to do and weren't really proactive, and they didn't call me, they didn't write me, and therefore they had difficulties. Now, I don't know about you, but I learn best when I can interact with someone. I can interact with a mentor. And basically, the Teaching of Talking 2.0 is very different from 1.0. The 1.0 is completely independent study. Okay? Everything's explained in 1.0, but for many people, they had some challenges with that because they could get no feedback from an expert. That's why we developed 2.0. 2.0 is where you get 1.0 Teaching of Talking, the whole Teaching of Talking method with the modules. But you also get me. You also get me who will help you, okay? I can meet with you and make sure that you understand the methods, and I can make sure that the goals for your loved one or for the goals of your patient are realistic and practical. I can teach you the speed at which to speak how many words to stimulate. I can teach you how to help your loved one or your client ask questions, answer questions. I can teach you about grammar, how we can fix the grammar, or even those with apraxia. I can show you ways to drastically improve apraxia that sometimes goes along with aphasia. And apraxia is difficulty making speech sounds. Well, I can show you what to do exactly. I've been working with this one man who had a stroke, and he couldn't produce hardly any sounds of speech. And all the therapists that he'd seen many, and all of them gave up on him and said that, he just was never going to learn to talk. But his mother contacted me, and we spent the first, I'd say 3-4 months just working on teaching him how to produce the speech sounds again. And then once he could produce the speech sounds, then we started teaching him how to say words. And now he's at the phrase and the sentence level. So I just want to assure you that if you are a care person or a therapist, and you're really serious about helping your loved one speak, then you would really benefit from working with someone and being mentored with someone, and that someone would be me. And I can show you exactly what to do. We can have a good time, we can laugh, we can joke around, while also improving speaking. Because I know that humor helps people learn and helps integrate information. So I've included Teaching of Talking 2.0 on this page of the website. And if you're interested in me helping you with learning the teaching of talking and implementing it, and if you're interested in having me meet your client or your loved one or your husband or your wife, I can do that, and I can help you. Every week I can help you and show you how to progress expediently towards improvement of speaking. So if you'd like to consider Teaching of Talking 2.0, remember that you get the Teaching of Talking 1.0 program, but what you also do is you get my mentoring, where I can meet with you twice a week and your loved one and teach you exactly what to do so that you won't have to make a lot of costly mistakes. You won't have to have any frustration. You can learn to do speech and language stimulation very quickly, and you can learn to do it like an expert with 46 years of experience, because I'm going to teach you how. So this is Mark Ittleman. Remember, if you'd like me to help you with the 2.0 Teaching of Talking, just send me an email at markittleman@teachingoftalking.com, and just let me know that you're interested in speaking with me about personal mentoring. And if you just do that and give me your email address and your phone number, I will have Malka contact you, and we can set up an appointment, and we can start helping you help your loved one or your client speak better today. So thank you, and don't forget to send me a note at markittleman@teachingoftalking.com and let me know that you're interested in the Teaching of Talking 2.0, where I will mentor you, and you will also get a personal copy of the whole video program with the modules and the book, The Teaching of Talking. So it's a really good deal, but what it really is a way to get your loved one, if your loved one is capable of understanding language and mimicking simple sounds, if they're capable of that, then they would probably be a good candidate for the teaching of talking method. And when I speak to you, we'll determine if your loved one is a good candidate. Now, there are a lot of them who therapists give up on, but who can really do quite well. It's just that the therapist may not be experienced enough. Or there may be some, and there are, people out there who are not good candidates for speech therapy. And in those cases, they need some type of augmentative device, an electronic device. But I've found that the majority of people are capable of learning how to speak, and we can find that out for you so that you can know if your loved one is really capable of learning how to talk again or not. So we'll see you. Don't forget to send me a line at teachingoftalking.com. Thank you very much and have a great day today.